This meeting of the Dundee Township Mental Health Board of July the 10th, 2025 is called to order. President of the board presiding. Secretary Corns, please call the roll.
Adame.
Present.
Auger. Connell.
Present.
Corns. Present. Harney.
Present.
Kempf. Avalar.
Present. There are no remote attendance requests. Will all please rise? Secretary Corns will lead us in the Pledge of Allegiance.
I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen. Chair will entertain a motion to approve the agenda with an amendment of item number 11D being moved to become 13C.
So moved.
Moved by Member Harney, second by Connell. Discussion? No discussion. Roll call, please.
Adame.
Yes.
Connell.
Yes.
Corns. Yes. Harney.
Yes.
And Avalar.
Yes. Agenda is adopted. Chair will entertain a motion to approve the meeting minutes of the June 12, 2025 regular meeting as presented.
So moved.
Moved by Adame.
I'll second.
Seconded by Connell. Discussion. Hearing none, all those in favor, please signify by saying aye. Aye. All opposed, same sign. Minutes are approved.
Can I abstain?
Okay, sorry about that. Didn't hear that. Make sure you capture that for the record, though. Chair will entertain a motion to approve the special meeting minutes of June the 23rd, 2025 as presented.
I'll move.
Moved by Corns.
Second.
Second by Connell. Discussion. All in favor, please signify by saying aye. Aye. All opposed, same sign. Special minutes are approved. We will now open up to public comment. Is there any member of the public who wish to address the board this evening? Seeing none, we're going to move on then to the financial report. Coordinator Sanchez. I'm sorry, we skipped the coordinator's report.
Yeah, that's
Let's
right.
start with that.
All right, that's where I was at. Okay, not a lot for updates this week, or this month, this week. This week's been a long month. Police social worker program, I do have meetings scheduled tomorrow. We're meeting with Carpentersville police staff and village staff, as well as other local police chiefs. And we're going to be discussing in earnest the expansion of the program, what that will look like, what all the interested parties are going to need going forward, so that we can develop a total plan to bring forward to this board for your consideration and potential approval. So as soon as I have something to update on this, I will send it out to the board in advance of our next meeting, just so that you're all up to date, up to speed on everything that's happening. And if there's any questions that you have along the way, let me know. So looking forward to that. Finally make some traction there. Some recent events and upcoming. There's the July 4th parade in Carpentersville, and I did see that ABC about behavioral change, one of the agencies that we fund, was there, and they were handing out flyers, information that also referenced the funding came from Dundee Township Mental Health Board, so that's good to see. National Night Out is coming up Tuesday, August 5th, so if anybody wants to bring the kids out, we will have a table there. It's always a good time, very well attended. And then the Community Leader Roundtable got rescheduled, so now it's going to be on Thursday, July 31st at 1 p.m. Obviously, it's an invitation-only event, but it is open to all elected officials and service providers and emergency response and all those. So, and that is pretty much it.
Okay.
Any questions?
Any questions from the board? Just one comment, this past Sunday was the 1-year anniversary of the Sonia Massey shooting in Sangamon County, and it'll be interesting what has been learned in the past year. I know the Massey Commission is still working on their recommendations in Sangamon County. If any of those crisis training that are being talked about at tomorrow's meeting, it'll be helpful to know. But obviously, we don't want to see it, nobody wants to see any tragedy like that, and certainly we don't want to see it in Dundee Township. So, but it has been a year since that happened. So, all right.
I guess I would add to that, that once we can finally say that we're underway with the police social worker expansion, that would be a good time to come back to the conversation about potentially helping support funding for the crisis intervention training for our police force, just to help offset some of their costs. Because it's very timely, and also a lot of police departments are looking more for that kind of training. So,
Okay.
Oh, and they had the Sangamon Police Department. They got a new police chief, and they've done some extensive work. All their officers have undergone de-escalation training now, and there's additional measures that they've been looking at as far as new recruits hiring. They no longer just accept reports from the former employer. They go to the office or to the place where the person worked before, and they are able to ask more questions and see if it will be a good fit for what they had in mind.
Okay. I know the commission's still doing its work to make more recommendations. I know they're going to referendum in March for their own county 708 mental health boards, so we'll wish them the best on that. And lots going on out there, and there are definitely some learnings we could reapply here if those opportunities are there. Okay, with the coordinator's report done, Chair will entertain a motion to approve the list of bills of the July financial report.
I'll move.
Okay, moved by Corrin, seconded by Connell. Discussion, Mr. Sanchez.
it's pretty straightforward this month. I did restructure a little bit what's reported on here. So now you can see the total fund balance, including what is budgeted for this year and any excess, the unbudgeted fund balance, the total distributions received from the county treasurer as we've begun getting those. And then underneath that, you see the total grant allocations, where we're at on that, and then the remaining of those allocated funds. And tonight, if the Community Crisis Center application is approved, then that number will go up for the grant allocation total.
Okay. Where is ABC's revised invoice?
They didn't get it to me in time to include in the packet. We were working on the work plans, and I realized that I didn't have that invoice still, and by the time they got it to me, it was too late. So that'll be coming up next month.
Okay, sure. Any other questions or comments from the board? All right, seeing none, Secretary, please call the roll.
Adame.
Yes.
Connell.
Yes.
Corins, yes. Harney.
Yes.
And Avalar.
Yes. Right, Chair will entertain a renewal of motion to approve the grant award for Community Crisis Center.
I'll move.
Moved by Corins, seconded by Adame. Discussion, this has come back from last month, and I think we have Community Crisis Center here tonight to,
Is there anyone from Community Crisis Center? I was told that there wouldn't be, because they're on vacation. There's a lot of people on vacation this early part of the month, so unfortunately they weren't able to attend this evening. So I did make calls to board members asking if they had any questions for the agency in advance of this meeting. Nobody indicated that they had anything pressing. I was able to answer any questions that everybody had regarding that application. So we can discuss it if you want. I can add anything that I have information-wise available to me.
okay. Any discussions from the board?
I think we should provide funding, just given the needs report and that they are really the only other homeless shelter providing services outside of Elgin Pads. I feel like it's the closest thing that's serving our community, and I would argue that anyone entering into their crisis center is undergoing some type of mental health crisis or substance abuse challenge. And from what it sounds like, they said that they can report that as well. They don't typically, but if that's something we're asking of them, that they'd be willing to do that. So I think that we should extend funding to them.
Okay. Any other discussion?
I agree.
Okay. I would agree too, and if there's no more discussion, Secretary, please call the roll.
Adame.
Yes.
Connell.
Yes.
Corins, yes. Harney.
Yes.
Avalar.
Yes. All right, we will allocate to Community Crisis Center, and then we'll hopefully next month have their work plan ready for approval then. All right. Now we're turning over to the new business. Chair will entertain a motion to authorize the board president to execute funding agreement and work plan for associates in behavioral health care.
So moved.
So moved by Harney, second?
I'll second.
Second by Adame. Discussion, Mr. Sanchez.
This one is for all three of them. The funding agreement is our boilerplate funding agreement. It was simply updated with the new dates for this year. You have the work plans already. There may be a slight change to one of them. I got some response in the past 2 days. So nothing substantive. It was really just an addition of a description of the program. Some of those, right now, those ones are blank. So really, there's nothing substantive that will change on these. So the approval will be giving authority to President Avalar to sign these once fully completed.
Okay. Any comments or discussion from the board? Member Adame.
Just a comment for outcome goals and measurement. I would just ask, and it doesn't necessarily have to be, well, maybe it should be updated, but just a time frame in terms of like months when they expect to have this computer system upgraded, security software, all that stuff, like a time frame within the next couple months, just so we have an idea.
Okay.
And it helps them also stay accountable.
Yeah, it's a short activity period, so.
Okay, you got that? You captured
Mhm.
it? Okay.
Yep.
Any other comments or discussion? All right, hearing none, Secretary, please call the roll.
Adame. Connell.
Yes.
Correns, yes. Harney.
Yes.
Avalar.
Yes. Chair will entertain a motion to authorize the board president to execute the funding agreement and work plan for Ecker Center for Behavioral Health. Moved by Adame,
Second.
second by Harney. Discussion, Mr. Sanchez.
Nothing out of the ordinary. Again, you have the draft in front of you. So yeah, I don't expect there will be any changes other than the addition of the program description to this one.
Okay. Any comments from the board? All right, Secretary, please call the roll.
Adame.
Yes.
Connell.
Yes.
Correns, yes. Harney.
Yes.
Avalar.
Yes. Chair will entertain a motion to authorize the board president to execute funding agreement and work plan for Family Service Association of Greater Elgin. Moved by Adame,
Second.
second by Connell. Discussion, Mr. Sanchez.
Same as the other two, pretty straightforward.
Good. Any other comments or discussion? Secretary, please call the roll.
Adame.
Yes.
Connell.
Yes.
Correns, yes. Harney.
Yes.
Avalar.
Yes. All right. Discussion of updates to 2026 grant schedule.
What? I'm sorry, I don't have it pulled up in front of me. I don't, sorry, I thought I pulled it up. If you want me to put it on the screen, I can.
Please,
Real quick.
we have audience
Yeah.
members, so just don't take.
My apologies. So this is a revised timeline for the grant program for next year. So I will be sending this out to everyone with also the our funding priority documents for your review over the next couple weeks to provide some feedback in advance of our next meeting. But essentially, let's do it this way. Oops, all right. Zoomed in a little more. So just having some discussion tonight about, what priorities and targets you may have in mind already going into this new grant cycle. But over the next 2 weeks, seeking input from all board members on any changes that they'd like to see to those documents. And then that can be collated and distributed in advance of the next meeting, where you would then ideally be voting to approve those and also approving the next notice of funding opportunity. So that's the goal, is at the August meeting, we will be starting the opening of the applications for that next cycle for next year. So we'll accept the applications for a period of 30 days, as we typically do. We'll broadcast it any channels that we can to make sure that we're casting a wide net, and hopefully we'll be flush with applications. Then we'll go through the process, or the board will go through the process of reviewing. So we'll check in about a week later after the applications are sent out to everyone. And then we'll be looking for questions within the week after that you'll have for the applicants. Have a little time to get those responses, send them to you in advance of the October meeting. And that is where we will be asking all of the applicants to come in and present, and give everyone the opportunity to ask even more detailed questions if there are any, but just get an overview of the programs from the agencies themselves. And then the following month, into the November meeting, you'll be all sending in your scoring sheets, and we'll consolidate that and have those hopefully all awarded at the November meeting. And from there, we would obviously announce those awards, develop the contracts and work plans, have those approved at the December meeting, and then everyone gets to start on January 1st with all the programming. So that is the schedule as it is right now, updated. If there are any thoughts on this, if any of you think, maybe we need a little more, a little less time on some of these, let me know. But I think this will, as long as we keep to the schedule, it will go pretty smoothly.
Okay, any immediate comments from the board? One area I will point out as the schedule is aggressive, but it's doable. Certainly after the September 11th Mental Health Board meeting, please be sure to budget out the time it's going to take to review applications. Hopefully we're going to be flush with applications, and that's, but it does take time to review them and to review them thoroughly. And also, presumably we do the allocations at the November meeting. That will be right in line of when we're going to be submitting our recommended levy to the Township Board, which will be approved. The levy will be approved at the December Township Board meeting. So these are definitely intermingled purposely in order to ensure that the funding that we will ask for the 2025 levy that will be funded through 2026, that we will have that. We'll also by then have our draft budget for fiscal year 2027 at the same time. So all these are interrelated. It's an integrated model. Mr. Sanchez, thank you for honing the schedule for us, and we got a lot of work cut out for us, and that's what the voters wanted the Mental Health Board, and we're going to do our part to ensure the funding gets to the agencies and to the patients in Dundee Township that need it. So thank you. All right, thank you for that update. We're now going to go to discussion of outreach ideas for the Mental Health Board. Mr. Sanchez, would you like to kick this off?
Yeah, not a lot to add to this conversation at the moment, but I do think, we've had some public comment expressing interest on ideas and concepts the board could explore for outreach. And I do think, each individual board member probably has some of their own ideas as well. So I just wanted to make sure everybody's kind of putting that a little more to the top of their mind. If there are some other things that you'd like to see the board going after in terms of outreach that you think would be helpful for the board's goals, start sending those my way. And we can start to develop those into our plan. Not every idea everybody has is going to be worth the board pursuing, but we want to make sure we are capturing people's thoughts and intentions, and listening to the public, even if we receive input from the public. I always like to say good ideas come from the bottom, not always from the top. You never know where the next big idea is going to come from. So just again, allowing the board to be a little more open, and if you've got ideas, don't hold them back for sure. But we'll be following up on some of the ones that we've received from the public as well.
Okay. Any additional comments or discussion from board members? And I will comment that, in spite of what was said at last month's meeting, regular meeting, at public comment, though, we are looking for effective direction of how to get the message out about the Dundee Township Mental Health Board. And we will look at all options, and we will do it respectfully, as in our front lines are the agencies, the social service agencies, both the ones that we are currently funding as well as those who have wanted to be funded, for whatever reason they don't submit an application. So we'll be looking to the AIDs, and certainly the roundtable on July 31st will be another listening to the agencies and what they are seeing, what are they seeing now here in mid to late 2025 that is different, of course, with all the laws changing over the past few years. That is something that we are paying attention to. Hopefully, most of these laws are positive. We saw, for instance, the pharmacy benefits managers or PBM reform that was signed into law last week, and that was approved by bipartisan measure in the legislature, and hopefully that will enable patients to keep up with, to afford the medications that they are needing as they're prescribed, and to help them keep to an adherence plan that will help them. So, Member Connolly, you had a comment.
Yeah, last month we had public comments saying that we're not doing our job good enough with these agencies. Have we reached out to them and see what's going on?
I've asked,
I think that was Shafali.
I asked Coordinator Sanchez to follow up with the agencies. So far, we've only confirmed one conversation.
Because I would like to know what's going on. What are we doing is wrong?
Well, we're not doing, in my opinion, we're not doing anything wrong. Can anything be better? Of course. Continuous improvement, that's just good government, let alone good business. Coordinator Sanchez, any feedback you can share?
Yeah, I would say it's probably a conversation better to have offline, but the feedback I received was pretty positive, I would say.
Oh, that's good.
Yeah.
So that was not a lie maybe, or just non-truthful?
I can't speak to what anybody else has said or
Okay,
not.
because I take that seriously. I mean, we're doing our job.
Like I, as a private resident, I addressed the township board at their meeting last month, and I said, look, first, it's inappropriate to be talking to the agencies without corroboration with the mental health board. Leave us alone with our coordinator. And that's why I immediately signed Jarrett to find out what is really happening. We have the roundtable coming up on the 31st. I think if there's any real feedback that has been shared, this board, my first meeting back 3 years ago in August of 22, we adopted the fee for service as the way to fund the agency. So the capacity component, I don't know where that came from. I just take that as, like I spoke as an individual at their board meeting. I'm sure Shafali was speaking as an individual to us. So, but anyways, Mr.
I believe that we deserve a public apology.
I think.
Seriously, I think we do.
Well, I'm not going to, that, as Mr. Sanchez is saying, that's more of an offline discussion.
Oh, but that was in front of people in this office, in this room.
Yeah, but I think though, the township board, and especially Member Harney and her role on the township board, defended us very well. Both of us were at that meeting.
Mm-hmm.
And I think those who were in the meeting, particularly our elected board members, heard the full story at the dais last month on June 18th. So, it's up to Shafali if she feels she needs to do that. That's up to her. But we're going to continue doing our business the way that our one-year plan says. And when we update our strategic plan later this year, we are going to go by our plan. Okay. We plan our work and we work our plan. And that's how we're going to do it. But thank you. That's good feedback, but let's move forward and let's work our plan.
Got it.
Thank you. Any other comments?
I will take that back to the township board as well, of course. And I've asked Coordinator Sanchez to arrange some meetings for me with some of the provider agencies, because I wanted to approach them both as a township board member and as a 708 board member. I'd like to hear what they want, what they need, what their expectations are. I know one of the things that fell by the wayside when the former township board cut the funding so dramatically was an outreach program for homeless people from Acker Center, I believe it was, where they were going to have a psychiatrist and a psychiatric nurse. I think they were part-time positions, both of them, but literally go out to homeless encampments and talk to those people and offer them services, because from my perspective, if you weren't already mentally ill when you become homeless, you will be after a fairly short period of time. I cannot imagine living under that kind of strain and having to deal with that. So what I've read is that when people are pulled in and they are given the opportunity for some services, then they can accept other services, and maybe some of them can get to the point where they can move back into society and have a place to live and be functional again instead of being homeless. So I'd like to, just for my own because I have to go back to the board, and I wanted to make it clear, I will not be bringing back orders from the board at all, from the township board. I will be reporting to them, and my goal will be to make sure that they are very comfortable with a levy that is, that accounts for all the needs that are presented, through this process.
And as we are structurally want to ensure that the correct recommended levy based on the facts is sent to the township board, which is why the schedule that was shared earlier concerning grant year 2026, I mean, the timing is crucial, and it's not a coincidence because this goes right into our recommendation that we must make by November. And then, of course, we'll be finalizing the budget around the same time as well. Member Adami, you say something?
I have two ideas, going back to the outreach that I have just off the top of my head. The first one is, I know we have roundtables for providers, but maybe we could have something like conversations and coffee for the community. Just wondering if we could just go to the library and answer any questions regarding mental health or services. And since we are connected to so many providers, we could just refer them. Maybe do some outreach that way. So that could be.
Are you thinking that board members would be there to answer questions?
Yes, I would say one or two.
Yeah, we'd have to be careful with.
Yes, of course.
It's easy to slip into conversations about business.
Yeah.
But yeah.
Yeah, I think if we are there with the intent of providing resources, that can showcase people what we're here for, what we're doing, or what our goal is. The other thing is, I know I had talked about mental health first aid, so I'm wondering if we have funding left over, we could provide grants to community members who would like to be trained. Because I know there's some trainings for adolescents and adults, like a 16-hour course, I don't recall. But some community members, I'm thinking like 8 to 10 scholarships, and we can offer that, pay for that. We have 8 to 10 more people in our community who are prepared to respond to a crisis. So I think that's one way we could offer support.
Is there any outreach to the local ministers? I don't know if they still do this, but a few years ago, they would regularly meet, the local clergy people in the area. They would regularly meet, and that would seem to be a place, frequently clergymen and clergywomen are some of the first people to understand a parishioner's in trouble, and maybe that would be just a reminder to them that this resource is here now, and perhaps if they have a parishioner who is in need, they could direct them. I don't know if they still meet.
I know there are some providers who have, like I know of a provider who started working at Judson, off of Judson campus, and that was mainly what they focused on, providing some like mental health first aid to pastors and parishioners. I don't know if they're still doing that, but at least 2 years ago they were, so
Yeah.
I could get in contact with them and see.
Yeah, everything got so upended with COVID, and then
Yeah.
people weren't meeting anymore.
That's a great idea.
Okay.
And Judson's a good place to start.
Mhm.
It's a real, community of faith-connected people.
Okay. Good inputs there. You got them all? Good.
Yeah, and we have broken into the clergy, the faith leaders group with our roundtables finally. It took a little while to get some of them
great.
coming, but and they did mention there is some type of meeting that still exists amongst
good.
pastors and priests and fathers and all that.
And certainly just a matter of the local, obviously, a lot of the parishioners may not live in Dundee Township, even though they go to church in Dundee Township, and certainly ensuring the pastors have information wherever their congregation. If they have McHenry County, of course, they can go to McHenry County Mental Health. Obviously, we have our Dundee and wherever they might be. So that geography, I know it's a challenge for, at least at my church, so.
One of the thoughts I had, and I think I had shared this with Jarrett, was more of like an entry level. So it's not the full grant, but more of a support to the community for members that either don't have insurance that providers are taking, or have really high deductible insurances that they can't really afford counseling and the help that they need, or they're like prioritizing again paying their bills versus getting counseling help. And so if there's like a scholarship that we can share with some of the local counseling agencies or providers, that they can use based on location and then need, and say like, yes, we see you have that need. Unfortunately, we don't take your insurance, or we see that you would be paying $100 a session until your deductible's met. Here's what we can do to help, provide some support and offset that cost.
That'd be like short-term services, like 8 to 12 sessions.
Yeah, so almost like an EAP, like an employer offers, but that the mental health board is offering to the community, but through the providers, because we don't have a counselor at the township. Like I know there's some place like Hoffman Estates or Schaumburg or Hanover Park have their own like counseling agency within the village or town or whatever that we don't have. So it's like, how do we meet that need of the community using the providers that are in the community? And so that we're not overloading like FSA and ECHR and some of the places that they would get turned to for being uninsured or needing sliding scale.
Well, it's definitely the question of being uninsured is supposed to not be taking place anymore because of the changes to state law.
Supposed to.
And again, supposed to, but the metrics that we collect on something like that is something we would definitely share with our legislators, because that was signed in 2021. The behavioral standards, the Standards of Behavioral Health Act, which mandated insurance by 2023. And if we're still having that problem, then our legislators need to know that too. Because I can understand underinsured,
Right.
but uninsured, that should be a thing of the past. And if it's not, we will change it.
Yeah, and this also kind of gets into like those Alice households that we
Right.
discussed as part of our planning,
Yeah.
and addressing that sector, because that is a big challenge for a lot of people, especially in this area. Just knowing the district that I'm in, I was at a roundtable earlier today where they were discussing the potential impacts of some of the federal funding that's happening now, and that we may see a lot more people in that category in the next year or so.
Our friends in McHenry County, they're doing a lot of outreach into the homeless area. Are you familiar with some of the programs that they're doing?
No,
Okay.
not specifically.
All right. I'll direct that to you offline, but that's a possibility, because that is the big concern we're hearing. I was not at your roundtable, but I've heard in other channels where if fundings are cut, and granted, we know the HR 1 was passed, but that's not the appropriations. The actual appropriation will be passed later this year, so we really don't know what the real cut is.
Until
You just have a
next year.
blueprint. You just have a blueprint. And obviously, HHS's funding is going to be the one that impacts. And of course, with the reorganization of SAMHSA, that also could have an impact on our patients as well. I'll get you that information.
Okay.
I have
We
that.
could do limited grants too. I like the idea of covering deductibles, for a family, especially the people who are being cut. They're people who go through the insurance program, the Affordable Care Act. It's estimated that the average family, their yearly increase in insurance payments is going to be in the neighborhood of $1,500 a year. And that's a sizable amount. And that would seem to be something that would be a limited, you know what the limit is with the person when their deductible is met, but that would be a way to help people, get treatment if we help them meet their deductible. Or just pay it for them.
And just conceptually, as you're thinking about things like this would be outside of our competitive grant process. This would
Yeah.
be,
Yeah.
this is something we could develop and then have open.
Okay.
Yeah. So yeah, kind of like even what we're doing with the police social worker, like
Yeah.
it's kind of its own entity.
Yeah.
But, and even with I was gonna say with the Coffee Connect idea, like I know the Gale Borden Library has a librarian social worker that it sees a lot of the homeless and provides resources or information. And so I don't know if Dundee Township Library or the Park District would also benefit from, or want to consider something like that, even if it was a part-time position, if we could help provide that or help fund it.
Okay, good. Good discussion.
I'm sorry to interrupt. I had a question. This is my first time here. Do you guys at any point, some of the things that you're talking, it's not from McHenry County. I just opened up a practice in West Dundee. And so I was a board member in McHenry County, highly involved with the mental health board and the substance abuse coalition. So you guys were talking I can answer some of these questions. Do you guys ever open it up for comments from?
Well, we do have the public comment, and I'm going to ask if we're going to be going to an executive session immediately after this item. If you could leave your business card with Coordinator Sanchez, he can follow up. and then we can have that dialogue.
Thank you. I just didn't know the format, so I wanted to.
No worries, no worries.
Thank you.
Okay, thank you.
No, but good discussion and another good contact there.
Thank you for volunteering.
Thank you.
Yeah.
The information.
Looking at the scenes, I was like, I'm gonna be able to help you.
Excellent. Okay, well, with that, we're going to move on to number 12. Chair will entertain a motion to enter closed session for the appointment, employment, compensation, discipline, performance, or dismissal of specific employees.
I'll move.
Moved by Corrins, second by Connell. Roll call, please.
Adame. Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. Thank you, everyone, for attending. We'll be closing the doors. If you want to wait outside or in the hall there, we'll be opening up when we're done. Thank you. All right, are you ready to go to question?
Ready.
All right. Meeting of the regular session of the open session of the Dundee Township Mental Health Board is reconvened after executive session. Secretary, please call the roll.
Adame. Present. Connell.
Present.
Corrins, present. Harney.
Present.
Avalar.
Present. Chair will entertain a motion to permit the secretary to remove executive session recording off premises for the purpose of preparing executive session minutes.
I'll move.
Moved by Adame,
Second.
second by Connell. Discussion. Roll call, please.
Adame.
Yes.
Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. All right. Chair will now entertain a motion to authorize the board president to execute an amendment to the agreement with the administrative coordinator.
I'll move.
Moved by Adame,
Second.
second by Harney. Discussion. With some of the questions that have been raised about the administrative coordinator and hours, we've asked our attorney, the Mental Health Board's counsel, to prepare an amendment for the mechanism to ensure that the township, that the Mental Health Board funds that have been paid are accounted to by hours, and that is what this amendment does. And that's what, that's presented now for a formal board action. Any discussion from board members? Secretary, please call the roll.
Adame.
Yes.
Connell.
Yes.
Corrins, yes. Harney.
Yes.
Avalar.
Yes. Chair, all right,
And D.
exactly.
Or C.
I know, I got mine here, thanks. All right, Chair will entertain a motion to authorize the board president to issue a request for proposals for administrative services.
Move.
Moved by Corrins,
Second.
second by Harney. Discussion. All right, here is the rough timeline that was prepared back in June. And the dates need to be updated. But by approving this authorization, as we look to the long-term future of the Mental Health Board and the administrative coordinator position, we will be doing a very transparent search through a request for proposal. This board has not done something like this for over 2 years, but basically it is a structured process to ensure that we ensure that to the community and to the Mental Health Board and the patients here in Dundee Township that we're going to be bringing the most qualified administrative coordinator to be a major part of this Mental Health Board. So these dates will be updated. There is going to be an ad hoc hiring committee, and that is, those are appointments that the president can make, doesn't have to be made at a meeting. I'll definitely be looking for board members to volunteer. It'll be a 3-member committee. Once we set this, we ready the request for proposal. If you're interested, please feel free to reach out to me directly. And I see a 3-member committee being an important part of this hiring process. One thing I'll make very clear to everyone in the community is that the Mental Health Board will hire the administrator for the Dundee Township Mental Health Board. That is not something that the elected officials do. Just as the statute stands for anything with the budgeting, it also goes with the hiring. So definitely input will be welcome. Our official representative from the Township Board is here as a valuable member of the Mental Health Board. She's also the president pro tempore of the Mental Health Board, and we've worked very well together, and this will be a cooperative effort to ensure the right person is brought in And if we decide to contract this out to a firm, similar to how some of our neighboring boards, like Winnebago County, they go through the Region 1 Planning Agency for their administrative services, for their executive director, we will evaluate that too. So with your approval, we'll begin the process. Any other discussion? Secretary, please call the roll.
Adame,
Yes.
Connell,
Yes.
Corns, yes. Harney,
Yes,
Avlar.
Yes. Okay, we are now going to move to board discussion. Member Connell. Member Adame.
I just want to circle back to the discussion about reach ideas. I think this is something I've brought up in the past. Like, how can we help move these points along so that there are actionable steps and just not just ideas? So I'm wondering if someone can provide concrete direction in terms of like what we can do to make sure that these outreach ideas actually happen.
SMART goals.
Smart goals, yes.
That'll be good to know. Anything else? Member Corns? Member Harney? All right, moving to the board president update. First, I want to openly thank Jarrett for the terrific service and your willingness to help us bridge this gap as we go into this transition to the permanent coordinator position, however the RFP dictates. So I want to thank you for that tremendous, you've been terrific to work with, and certainly we're going to finish that project and we're going to make sure that the mental health board's in great hands. We will definitely be discussing this in much more detail at the August meeting, but on behalf of the mental health board, I do thank you because this has been I remember what it was like. Sue, you remember what it was like trying to run this without a coordinator. And yeah, we couldn't do it.
I'm not doing that again.
We're not doing that again. Exactly. So your inputs have been invaluable, and thank you, Mr. Sanchez. I thank you openly here. I want to ensure that to the community, and certainly, over my past 3 years here on the mental health board, first, I'm thankful and I'm honored to be serving the president. This is the 5th time I've been elected the president of this board. And one thing I've done trying to lead this board, and we came out of 2022 into 2023 with so many challenges, but working together as a board, we've achieved the goals that the voters entrusted us to do in the 2020 referendum. Could some things be made better? Yes, we'll admit that. Well, one thing I have been managing this board, leading this board, is I will not let any kind of extreme elements, and I don't care if it's the far right, the far left, or the far right, anything in between. Those kind of petty politics is not going to interfere with the charge that we have to service the residents of Dundee Township. And I've definitely been seeing activity from both ends of the spectrum. I do read some of the things that are said on social media. I don't respond to them directly. I don't respond to them even indirectly. I just listen. It's community input. But we've got our plan. This board has developed a plan, and we're going to update our longer-term 3-year strategic plan, include the outreach ideas. But I will not let, and just because what happened in the election on April 1st, we're not electeds, and that's for a reason. And many people are misinterpreting what the election meant. The election did not change because we were not on the ballot. What past elected officials did or did not do, that's in the past. We're working forward, we're moving forward, we're going to meet the needs of this community. And many of us have been touched firsthand, no matter who's been touched more, on the mental health needs of this township. This board has been working effectively with our state legislators to ensure that the best possible laws are passed. Whether they're being fully implemented, we're going to find that out too, and we're going to let them know. But we are a cohesive board. And even though we're only 5 members tonight, when all 7 of us are here, you're going to see even better things happen. So let's keep our eyes forward. Let's not try to relive things from the past or the distant past. Let's move forward and let's be the benefit and help the patients in Dundee Township who need these services. So with that, I will ask just two other things. One, I remind board members, the Association of Community Mental Health Authorities of Illinois, or ACMI, their meetings, it's all virtual, is at the start of next month. You should have received the emails by now. Feel free to sign up if your schedule allows. Mr. Sanchez.
And I forgot to mention that as well, so thank you for covering that. Back to what you're talking about with this position, it's been an honor, it continues to be an honor to serve this board in any capacity that I'm able to. So I'm happy that we've been able to move it forward, accomplish a lot of the goals that we've all had. I know I had my own personal goals of how I wanted to see this board move forward and achieve. And I think we're in a really good place. As said before, a lot of the feedback I got from service providers and talking to them was very positive. They're very happy to see a new fledgling board that's really digging in, asking a lot of good questions, being very mindful about the taxpayers' money, but getting the money out there. And with tonight's approval of the Community Crisis Center award, that brings the total for this grant year to $452,900. So that's more than what you even budgeted for. It's what I've been telling people in the public when I've had conversations about this board and where we're going, that we are going to keep increasing that number. And that was the impetus for this second round of grant funding this year. So just that alone shows you might need a little more money in your budget next year. Now add the police social worker program and potentially some things like scholarships and reimbursements for other types of things. There are a lot of opportunities to capture going forward, and so I'm really excited to see what happens in the next year with this board, and that's all I have to say.
Thank you.
Thank you.
Thank you so much.
Look, I'd like to add just a little bit. As a person who's been sitting through this almost, from the beginning, Jarrett was enormously instrumental and, in fact, a critical part of getting the township board to fund the mental health board. We had members who did not want to fund it at all. And Jared bridged that gap and did a really excellent job. I think, I see where you want to go from now on, and I'm fine, great, and I'm all in on getting somebody in here who can carry us to the next level. But I want to say thank you too, because I sat on that board and I was pretty upset at times with several other this is township board members who didn't seem to feel that this was at all necessary, that the voters needed to be listened to. And of course, that's what happened, I think, during the election, is that a good number of the public came out and said, no, we voted to do this and we want it funded. So this new board is much more open to funding things at a level which is suitable and adequate.
And it's also, to complement what you just said too, the laws have changed to where we're also much more flexible to what we can do with the levy. The tax cap, or PTEL, property tax extension limitation law, no longer applies to mental health levies. And there are some excellent ideas I've heard from the board. How might we get the county better engaged, and possibly maybe even looking at sales taxes? I know sin taxes were brought up. We're going to look at all options, because what our neighbors did in McHenry County, switching from a property tax base to a sales tax base. Now, counties can do that. Townships can't. But there are ways, and we will seek those ways to do that and do it the right way. As many of y'all know, I did give that input back in late 2023, and the voters responded. I just pointed people in the right direction. They passed it. To their credit, they passed it, and it passed by just over 5 percentage points. It was a close vote, but you had that time in the community where, Democrats and Republicans and mental health providers and people, they may not have been standing side by side, but they were working together for the common goal. And that's what we're going to do, that and then some here in Dundee. And with that, I'll entertain a motion to adjourn.
Motion.
I'll second.
Okay, motion by Connell, seconded by Adame. She was faster. All those in favor, please signify by saying aye. Aye. All opposed, same sign. Adjourned.
I'll post it.